Welcome to The Explainer. So, have you ever wondered why the pharmaceutical industry, we're talking about an industry that creates these incredible life-saving innovations, often seems to struggle when it comes to internal digital change? Well, today we're going to break down the very unique reasons why this happens, and then we'll lay out exactly what a successful playbook for transformation really looks like. All right, let's just jump right to the heart of the problem with one single number, 51%. Now, what do you think this represents in the world of pharma tech? You might think it's about technology or budgets, but it's not. And there it is, that 51%, that's the measure of human resistance. This whole challenge isn't really about a lack of amazing technology or a shortage of brilliant ideas. Nope, it's about people. And this creates a fascinating problem we're going to call pharma's digital paradox. And this right here is the paradox at the very core of this whole issue. On one hand, you've got this industry that is literally pushing the boundaries of science. But on the other hand, the internal systems and processes, they can be surprisingly resistant to change. So let's dig into why that is. And believe me, the consequences of ignoring this human element are serious. We are talking about way more than just a few project delays. This can spiral into major compliance issues, regulatory findings, and, you guessed it, ultimately it can put patient safety at risk. Okay, so let's really dive into why this happens. You see, pharma isn't like other industries just launching some new app. It operates behind what you could almost call a wall, a unique wall built from the bricks of intense compliance and a very, very deeply ingrained culture. This chart, it kind of breaks down that wall for us. As we saw, human resistance is the biggest piece of it, but it's held firmly in place by two other really powerful forces: a culture that is, for good reason, extremely risk-averse, and the constant pressure of budget constraints. These three things, they all feed into each other. So let's break down that why. First, that risk-averse culture isn't a flaw, it's a feature, and it's designed to protect patients. Then you pile on the heavy global regulations from bodies like the FDA. Every single new digital system has to be rigorously validated, which is just a fancy way of saying it has to be proven to work exactly as intended every single time. And to top it off, the very departments that need to work together on this, like quality, IT, and operations, often operate in their own separate worlds. It really creates the perfect storm for slowing down any kind of change. So, how in the world do you navigate this incredibly complex environment? Well, the good news is there are some really well-established frameworks out there to guide the way. We're going to take a look at two of the most effective models for managing the human side of change. First up, we have Proce's ADKAR model. What's brilliant about this framework is that it focuses on the 5 sequential steps an individual has to go through to make a change successfully. It all starts with awareness that a change is needed and ends with reinforcement to make that change stick. And then, complementing that focus on the individual, we have Kotter's 8-step model. This one gives you a high-level process for leading change across an entire organization. It really emphasizes things like creating a sense of urgency and building a powerful guiding coalition. So think of it this way. One is for the person, the other is for the whole system. Now, here's the really crucial part. The key isn't just knowing these models exist. It's all about adapting them for the pharmaceutical world. You have to learn how to translate them into the language of GMP, that's good manufacturing practices, which are really the core quality standards for the entire industry. And the key to this whole translation is connecting these models back to the industry's own rulebook. A perfect example is the ICHQ 10 guideline. It's an international standard for quality systems, and it basically says that change management isn't just a suggestion, it is a core, non-negotiable requirement for being compliant. And this is where the theory really meets practice. You take a standard stage from ADKAR, like knowledge, and you adapt it specifically for pharma. See, it's not enough to know how the new software works. You have to understand the GMP and validation requirements that go with it. Or desire. It's not about selling cool new features, it's about clearly demonstrating how this change is actually going to enhance patient safety. Okay, so before you even think about starting this journey, you need a map. A readiness assessment is that first, absolutely critical step to understanding where your organization stands today, and you do this before a single dollar is spent on new tech. A tool like this assessment wheel gives you a 360-degree view of your organization's readiness. It measures everything, from your current digital capabilities to your risk management maturity. It helps you identify your strengths and, maybe even more importantly, the gaps you need to fill before you get started. This assessment helps you pinpoint exactly where you are on a digital maturity roadmap, something like this one. Are you still in the pre-digital stage with mostly manual processes? Or are you moving towards an optimized state where your digital tools are actually driving strategic value? And this right here is why that assessment is so incredibly vital. A McKinsey study found that pharma's average digital maturity score is just 27 out of 100. I mean, that's trailing even other highly regulated industries like banking. There is a lot of room for improvement, and just knowing your own starting point gives you a major strategic advantage. All right, let's bring all of this home with a final and most crucial takeaway. This is all about a fundamental shift in thinking for the entire industry. This is the core idea. In the pharmaceutical world, change management can't just be some fuzzy, soft skill. It has to be treated with the same level of rigor as any GXP process. That's the umbrella term for all those good practices regulations. It has to be a validated, metric-driven discipline because it directly impacts quality and, of course, patient safety. So, the shift in mindset we need is crystal clear. We have to move structured change management from that nice-to-have column way over to the validated, compliant, and absolutely essential column. And why? Because in this digital age, it is a core competency that is required to safeguard patients. It's as simple as that. So, we'll leave you with this one question to think about. Is your organization truly managing change, or is change managing you? Thanks for joining us for this explainer.